Welcome to our Bariatric Nutrition Basics course. My name is Alyssa Lunning. I'm a registered dietitian, and I'm here to go over some of the general information that might help you to have a successful pre- and post-operative nutrition experience. One of the first things I always like to break down on an initial visit is that when you start to look at information about bariatric surgery or anything about nutrition online, it is really important to check and see who is providing the information. So every dietitian is a nutritionist, but not every nutritionist is a dietitian. And so that means that a dietitian has been someone who's been trained with a lot of medical practice. So we've worked with doctors, with surgeons, we read labs, we do a lot of the work that happens in a clinical environment. Whereas a nutritionist likes nutrition. And so their credentials may not have as much of a medical background. Surgery is a tool. So many times when you learn about weight loss surgery, you are told that weight loss surgery is just one of the many tools available to help you with your healthy weight. What doesn't cause the long-term weight loss, you do. It can help you learn and apply the behaviors to lose the weight and to keep it off. However, if you don't use the weight loss surgery tool to help you change those behaviors in the long term, you may experience some serious health problems or, unfortunately, weight regain. So before committing to weight loss surgery, assess whether you are ready to commit and to take what it needs to succeed. Many times when we talk about bariatric surgery and weight loss, a lot of patients come to their appointment having had a very diverse experience in different diet strategies, whether or not they've done the Atkins diet, counted calories, or any of their programs that are out these days. When somebody asks, can't you just diet and exercise? Well, the answer is because it is very different. There are changes that happen to your body that do not occur without the surgery. One of the first changes is that your stomach size can only hold about 4 to 6 ounces, period. If you go over that portion size, the room in your tiny tummy cannot handle it. And so oftentimes within that first year after the procedure, your portion sizes become tiny, but it becomes the new normal. Right now, if you were to follow that type of diet, your appetite might come back and you would regain the weight that you lost. But after surgeries like the gastric sleeve, your hormones actually change. And so there is a hormone that can make you feel hungry in the big portion of your stomach that is removed. After surgery, you do not have as much of a sensation. It will come back and you will feel hungry again. But you have that nice time period after your surgery where it's actually much easier for you to follow the recommended portion sizes and maintain your low-calorie diet. So when you go on a diet, this cycle might look really familiar to you. You start the diet, you're very motivated, you get everything together, and you start to lose weight, and that's fun and wonderful. But over time, some of the bad, quote-unquote, foods start creeping in, and unfortunately, as life does, it changes, old habits get in the way, and we have a weight regain that can be very frustrating and just put you in the cycle over and over again. After bariatric surgery, the part that gets eliminated from this cycle that will break you free for a bit of time is that your old eating habits will not return, not for a while, because that portion size is stuck and it's limited. So your old eating habits should not return in that time frame in which that you're losing weight. So you can keep on going to a successful long-term weight loss and weight loss maintenance. So as you're preparing for weight loss surgery, again, remember it doesn't cause the long-term weight loss. It is you. It's on you. So don't compare your success to other people. Every person who gets this surgery is unique. It's so important to gather the people around you who will support you and to also recognize the people who might be out to sabotage. There are a lot of different questions to ask yourself, and many people have had their own experience. Think about Am I ready to be rerouted? Do I understand that I'm going to have to make these changes for the rest of my life? And are you willing to seek the support necessary for success? All right, so we're still preparing for the next few steps. You've checked this first one off the list. This is the class. Nice job. If we haven't had our first nutrition appointment, we have to get one on the schedule so we can meet and make sure that we have resources in place that fit you, your dietary needs, and what you like, what your life is like. We also like to have you come in another time before your surgery to make sure that you have a plan for your supplements, your protein, and your vitamins. And we also always want you to come to support group. If you don't have a friend or family member who's local to you who has had this surgery, it is so helpful to know other people who have either gone through it or who are also going through it. The changes are extremely unique, and if somebody has not gone through it, they don't really understand. So support's very helpful. We got a lot of visits ahead. Even after your surgery for nutrition counseling, I want to follow you when you see the doctor. So you could talk to the doctor about a lot of things, your weight management, your medications, and then we get to talk about what's going on with the different fluids that you're taking in. At our follow-up appointments, we talk about how you're doing getting in your fluids, how you're doing meeting your protein goals, and how your digestive system is working for you. But then we don't stop there. Every 3 months, 6 months, 9 months, 1 year, 1.5 years, and then annual after your surgery, it is so helpful for you to come and visit us, your bariatric surgeon and your dietitian, so that we can check your blood work. We want to make sure at any point during this process, we're not giving you recommendations for supplements that you might not need. And it can help to save your budget and maintain a healthy long-term diet, and help to maintain affordability in your healthy eating patterns. All right, so as we're getting prepared for surgery, there are a lot of different dietary habits, activity habits, and just general lifestyle and behavioral habits that you know are going to change moving forward. Go over this list, and we'll go over it again when we have each other in the office, but things that you've likely heard of before in the past: cutting out simple sugars, decreasing fried foods, increasing activity. These are things that we should have a plan to change, and we'll put a date on it. Before we finish the program for today, I want to wrap up with an answer to a question that many people have when they first come to the bariatric seminar. What is the pre-op diet? So many different doctors, bariatric surgeons that I've worked for, might have their own suggestions or guidelines. But in a nutshell, in the 2 weeks before your surgery, if you follow a diet that is low in calories for that extended period of time, you're going to have a reduced liver size by 50 to 60%. And when that happens, it's easier for the doctor to perform the procedure, and you also get to heal more quickly and have way less post-operative complications. So for the temporary inconvenience that it might cause those 2 weeks before surgery to follow such a strict diet, be happy and proud in knowing this might be the last time you have to do something like this moving forward. The benefits of this diet program help you to not only start to measure your portion sizes, but also to start to gather in nutrients from fruits, vegetables, and the use of some protein supplements. So we'll talk about this again and see what it looks like for you on your first visit. After your surgery, there are a series of different stages of the diet that you're going to follow. And it's really to make sure that your healing goes super, super well. We want to make sure that after your procedure, you are well hydrated and getting enough fluids. After those first few days, we go into a full liquid diet where your foods have a little bit more nutrition in them, but they're still very easy to digest, and you're getting a high protein content to help you to heal from the procedure itself. By the time we're about 2 weeks out from the surgery, you're going to be able to incorporate some soft foods into your diet. And no, it doesn't have to be baby food. We can work with the things that you like, and we can work with the things that we have. But we need to make a plan so that you get your nutrition in and we heal you all the way to that 1 month post-op. During that time period, when your diet is advancing back to your full liquids and back to soft foods, as you can imagine, there are some nutrients that are missing. But don't worry. There are companies that specifically study bariatric patients and what types of nutrients are beneficial for them to supplement with after their surgery. And not only do they study the supplements, they have some nice recipes too. So when we have our visit and when you come for support group, we'll make sure that you're familiar with the different options available, such as those from Celebrate, who have some bariatric calcium, vitamin, and protein supplements. There are many different bariatric supplement companies out there, and it's not just Celebrate. But what's important to know is that the supplements that you take are very much close enough to meet what your body requires. As this chart illustrates, even though vitamins are out there, Flintstones, Centrum, ones that you've seen probably many, many times, they just don't quite cut the mustard. So we have a recommendation baseline of, let's say, 12 milligrams of thiamine. That's a B vitamin. These B vitamins are important for your energy and to make sure that you don't have significant malnutrition, signs and symptoms like hair loss or change in health of your skin and nails. When they recommend 12 milligrams of thiamine, unfortunately our Flintstones with iron only gives us a solid 0.6 milligrams. So although these vitamins are available and we do recommend to take whatever you have access to, I want to make sure that you have all the information so you can do the best with what you have. We know you need support because we all do. So check out our support groups. We have them every month. You might meet some of the doctors, some of the people who help with the vitamin supplements, but mostly you'll be able to meet with each other. Have a few goals in mind as you're getting ready for your next nutrition appointment or for your appointment with any of your doctors in your plan in preparation for surgery. Starting to think of different things that you need to change, like chewing really, really slowly or not drinking and eating at the same time. Different physical activity goals. Are you going to get a gym membership? How are you going to track your activity? And start to think about what are the top things that you want to address in your diet now that you know that we can start to change moving forward. All right, thank you for tuning in. Next steps: schedule your initial appointment with the dietitian, schedule your support group, follow up with your surgeon and all your doctors you need to check in to make sure you are strong, healthy, and ready to make this wonderful decision that'll increase the length and quality of your life. Keep us updated. Have a great day.